there, my name is Dr. Alyssa M.K. I'm a doctor of audiology and I work out of Calgary Hearing Aid and Audiology at our Heritage and McLeod Trail Clinic location. I'm here to talk to you a little bit about what our clinic is and maybe some of the importance about why you should consider having your hearing tested, even if it's something you don't quite have a problem with yet. Our clinic is something that has been around for a long time, so over 20 plus years. This is a locally and independently owned clinic, and we have 4 locations within Calgary, along with a satellite location in Strathmore. We have multiple clinicians at our clinics, including audiologists such as myself, as well as hearing aid practitioners. All of us are registered clinicians within the province of Alberta. When we start to look at the differences from a hearing test to a hearing screening, we start to think about different things we see on the side of the road saying free hearing tests, come get your hearing checked, and maybe sometimes those aren't necessarily a full comprehensive exam. But either way, it's something that gets you in the door to have your hearing checked on a somewhat, hopefully, regular basis. When we look at the importance of a hearing test, we start to consider the fact that we don't necessarily need to have it tested if we have just hearing problems, but maybe also when we have no problems existing already, simply to have a baseline. When we have hearing tests that are a baseline, it gives us an idea if your hearing is normal. Therefore, if something happens in the future, we can check and see, was there a change? Do you get your eyes tested every year? Maybe every 2 years? We have the same recommendations for hearing tests. In terms of hearing and understanding, there's 2 different topics when that comes into play. People can hear and they might not understand. That's going to be something a little bit different than just hearing loss, but maybe hearing understanding. And some people may have more need for specialized testing when that occurs. Our clinic does offer different types of testing, not necessarily just a hearing test, but also testing that looks further into different auditory issues. This would include pediatric hearing tests. This could include auditory processing hearing assessments. It may also include different tinnitus evaluations in order to help you understand what your hearing needs are or what your ear needs are. Hearing healthcare providers are present in private clinics, but they're also present in audiology services through Alberta Healthcare Service. We look at a hearing test as our starting point for when we start to figure out if there's an issue and when do we need to actually do something about it. When we start to look at having a hearing test completed, it's important to find a provider that you're comfortable with, that is knowledgeable and able to give you an unbiased opinion. Where we're a locally owned independent clinic, we're able to provide those unbiased opinions because we're not necessarily influenced by a different manufacturer for hearing aids or anything in that matter, because we actually provide all 7 major manufacturers at our clinics. As we think about hearing tests, we're going to be doing more than just looking in your ears. We're also going to be doing different measurements on equipment to determine the function of our ear health, but also what are we hearing and what are we understanding by actually using some of our sound booths and finding the sounds that we hear, but also what words do we understand. So when we look at a hearing test versus a hearing screening, a screening may not provide all of that information. It may only be part of some of the diagnostics. But a hearing exam or a hearing test that's comprehensive will include a lot of those different tests between words, hearing, ear function, and health. There are multiple kinds of clinicians, as stated already, between an audiologist or a hearing aid practitioner. This is going to be important because we both do similar jobs in some areas, but there's also differences between the 2 clinicians. Where we have the access to audiologists and hearing aid practitioners, we get to utilize that interprofessional relationship so that we have the best hearing options for our patients and looking at diagnostics as well as hearing health and hearing aids for treatment. but we also have then the flexibility to allow people to choose maybe where do they want to go or who do they want to see, given who they're comfortable seeing. Sometimes we have great experiences with patients that are new to us, that they don't know the difference between an audiologist or a hearing aid practitioner, and it won't make much of a difference. There's definitely importance between having the two different clinicians, being an audiologist and a hearing aid practitioner. There are some differences between our profession, but there's definitely value between the interprofessional practice. For example, people that maybe have more issues with tinnitus or processing delays. If we see pediatric children coming in for hearing tests, these are people that may likely see an audiologist more often than a hearing aid practitioner. But in most instances, both clinicians can help for a lot of these similar concerns between ringing in our ears, or even looking at our ears feeling plugged, or that we're not hearing as clear as we used to. Differences between the professions, though, majorly lie in our pediatric population. A hearing aid practitioner will not be able to see a pediatric population under the age of 18. An audiologist is able to see pediatric population under the age of 18. And there's a couple of ways for children to be tested in the province of Alberta. One of them is through our public audiology system with Alberta Health Services, and the other would be with our private clinics such as Calgary Hearing Aid and Audiology, where we will see ages 5 years old to 18 years old for our audiologists' hearing testing. When we start to look at what we do after a hearing test, if we have problems that have been identified, we want to definitely discuss the importance of hearing health and what do we do with treatment paths. Some of that may include looking at hearing aids or amplification. Other parts of it may include auditory rehabilitation. This would be something we work with on a regular basis with our patients. Whether or not you got your hearing aids 2 weeks ago or you've had your hearing aids for 2 years, we're always trying to help improve ways to increase our speech understanding. Other things that we can start to consider with regards to what do we do next? What if your hearing is normal? You still want to come in and have it reassessed every 2 years. This is something that's a general recommendation for pretty much every age range. Most of the time, children may be assessed in their school system through speech-language pathologists or even an audiologist. Sometimes they may not be coming in for hearing tests as frequently. But once we hit adult age, we definitely want to consider that fact that you should get a baseline test and then start to consider what influences your ears that you would then need to have further testing, such as noise or medications or even different medical injuries or instances. Without our patients, there is no us. We are here to help our patients. And in that patient-centered care, we want to make sure everybody feels included in their care options, but also in the education of what we're presenting, so that we are here to be that public education to help our patients and even their family members or their friends. What is hearing healthcare? How do we hear, and how do we hear better when we have problems that present? So if you definitely feel like something's wrong, come give us a call. You do not need a referral to come see our clinics and get your hearing tested, because there's no harm in having one test done to know what's going on. Let's see you at our next appointment.